Another common flexibility exercise or a problem with in regards to the neck or the cervical spine is the inability for patients to oftentimes look up and back because of posture and the environment people work in. So if you have a patient look up and back and sitting, go ahead and look up and back and sitting. A lot of times a lot of it comes from the upper neck and not much from the lower neck, right? And you can cue a patient to sit up nice and tall and have them look up and back, and it gets a little bit better, okay? But the ongoing problem is there's loss of movement that occurs from the mid-neck down to the lower neck. And this is a problem with people, right? So a way to have them work on this exercise and on this exercise is to have them work on it, get up from their desk and work on it standing. So if you have the person stand up, right? And they can utilize, again, their, in this case, you can see how it's much easier. If you ask the person to look up and back and standing, naturally you'll get a little bit more movement down in the lower mid-neck because, again, you're not having to fight the shoulders and you're not having to fight the posture of sitting, which is, again, eliminating the neck from moving well, right? And another nice way to kind of even help that better, if you have a look at and watch the patient look up and back here, go ahead and do that again. If she does that, she does it pretty well, and back out of that, good. But if she uses her good arms, which they oftentimes have, and she brings her arms overhead, and she pulls her elbows in her back pockets, there'll be go ahead and look up and back, as far as you can, good. And then just relax, okay? So flexibility exercise for the neck, and you can see the difference in the movement by just utilizing this pivot prone position to help her look up and back versus doing it without her arms. So all the way up and back, good, hands over, pull down and back like this, and then look up and back. Beautiful, good. And then just relax. So a flexibility exercise to promote cervical spine extension done in standing.